thank you so much. My name is Melissa Onate.
Hi, my name is Bernice Mbullu.
We're gonna talk a little bit more about Infinite Legacy, what we do for our community, and how we can make an impact when we talk about organ donation, but also when we talk about public health issues that affect diverse communities throughout the state and the DMV area.
Yeah, you can just click it all. Cool. There we go. So we're coming from an organ procurement organization. So our organ procurement organization, short-term OPO, serves the entire state of Maryland, Northern Virginia, and Washington, D.C. So that means 15 of us to around 10 million residents. So we get the opportunity to facilitate organ donation at our organization, but for us specifically in community outreach, we are the ones who are responsible for providing that education to the community. So we have 68 hospitals specifically that we partner with, and out of the 8 transplant centers, the 2 based in Maryland are the University of Maryland, which is in Baltimore City, and then also Johns Hopkins University, Johns Hopkins Hospital, excuse me.
Okay. So nationally, we have around 100,000 people that are currently waiting for a life-saving organ. From these people, every 9 minutes, someone new gets added to the list. Unfortunately, between 17, 20, I believe the number is now 22 people die every single day waiting because they're not able to receive this gift on time. From those 100,000 people, Black and brown communities are at the top of the list, sometimes because of misinformation, mistrust, or different health barriers, not access to education, not access to a healthcare provider. So we work with Donate Life Maryland, Donate Life DC, and Donate Life Virginia. Donate Life America is the brand you see when you go to the MBA and you get your permit, your license. I'm sure most of you have it now. Part of the experience is that they ask you about organ donation. So Donate Life is the national brand of the cause, but Infinite Legacy does the clinical portion of doing the recovery, approaching families, and doing the aftercare process.
So we wanted to show you guys our organization active within the community. So these photos are actually from our block parties. We have had, I believe we had around 6 block parties this year.
Yeah, 6 or 7.
Yeah, 6 or 7 block parties. So they take place specifically under the Decision Project, which is our grassroots initiative. We're going to get into a few minutes. But our goal is to not only provide information, but also be a resource to our community members, because we understand that for some people, food insecurity, housing insecurity, there are a plethora of issues that people might be battling that come first before even making that decision to be an organ, eye, and tissue donor.
So what is the Decision Project? The Decision Project is a grassroots initiative within Infinite Legacy. A couple years ago, we started to notice that certain zip codes throughout our service area, at the time it was Maryland and certain Maryland except Charles County and Montgomery County, certain areas had lower designation rates but had the highest need for organ donation. So we were wondering, why is that? So we did more digging, we did focus groups around the zip code that Johns Hopkins Hospital was located. We had the lowest designation rates. Multiple things were because of mistrust, medical mistrust, just barriers. And we started to dig a little more, like Bernice said, what can we do? Sometimes organ donation is not at the forefront of people's minds if you don't have housing security or if you are worried about what your next meal is going to be. So the Decision Project is all about giving back to the community and empowering them to make a decision for themselves once they have the information to say yes or no. It's about educating and it's about inspiring other people about making your own decision, and also just empowering them with the resources that they need.
So specifically within the state of Maryland, DC, and Virginia, these are all of our Decision Project zip codes. But here in Howard County, in Columbia, zip codes 21044 and 21045 are also areas in which we have, as Melissa mentioned earlier, higher need for organ donation. So somebody's more likely to have a neighbor that they know is waiting for a transplant, or trying to get on the wait list for a transplant, but everyone in the community is not registered as an organ donor, or people are less likely to be registered as an organ donor.
And particularly certain areas in Colombia, because we've had some focus groups, we noticed that it's areas where there's people from different countries, and oftentimes you carry the beliefs that you had in your country, or it gets passed down from generations. So different cultural beliefs, sometimes people don't know about the topic, multiple barriers that we've faced. But like Bernice mentioned, those are some of the zip codes that we're currently focusing on.
And so we wanted to show you some of the amazing work that we've been able to do thus far this year. Melissa and Maria were able to provide the Neighbors First Financial Literacy Program in Baltimore City, in Highlandtown. We had, from the focus groups, do you want to share a little bit more about that?
Yeah, so when we did focus groups with Spanish speakers, this was the first time that we were able to do a focus group fully in Spanish. A lot of the things that came up from those was that people needed more financial education. Like they felt like they didn't know what credit score was, like what does that mean here in the States? It's very different from South America, Latin America. So we partnered with M&T Bank, and we started providing people with basic information, like basic workshops. We were able to get around 7 or 8 sessions on just educating people. So the Decision Project is all about just connecting resources and community while educating about what we do, which is organ donation, but also just empowering people with the tools that they need.
And then on February 14th, which was Valentine's Day, which is also National Heart Day, I believe. Yes. We were able to provide we had an open community dialogue. It was basically to honor Henrietta Lacks's legacy. So we partnered with the Henrietta Lacks Foundation to speak about medical mistrust within the community. So we were able to have an amazing panelist. That's actually Alfred Carter Lacks Jr., who is a descendant of Henrietta Lacks. So we worked together to talk a little bit more about organ donation, medical mistrust, and how we can work together moving forward to kind of help destigmatize a lot of the medical mistrust within our community, and then also hold each other accountable as well. And then these are also some photos from our block party. We provide, one of the services that we provide, usually sometimes depending whether it's back to school or the beginning of summer, are actually free haircuts for people within the community, so that way they can have that access to that, because we know that might be a need or a barrier that some people may have a need for. And the other photo is just a photo of, from our financial literacy class. Yes. Yeah, that is all.
Thank you so much for coming.